Hello, my name is Susan. I'm going to be your nurse today. Per the physician's orders, I will be doing a wet to dry dressing change. Could you please verify your name and date of birth? Jack Buzzard 1029XX. Okay, and let me see your wristband. 10 Jack Buzzard 1029XX. Jack Buzzard 1029XX. All right, thank you. All right, I'll perform hand hygiene. I'll put on clean gloves. Let me just raise your bed to waist level and then lower your top side rail. Okay, so I have my, are you allergic to anything? Any allergies I should know about? No. And are you experiencing any pain right now at your wound site or anywhere? No? Okay, great. Okay, so I already have my nurse's tray set up. I have my irrigation. I have my irrigation tray. My irrigation already has sterile water or normal saline solution in it. I have my wound care kit, which comes with a drape. It also comes with a biohazard bag, which I've already set up. It comes with tape that I have. I have medical scissors. I have my wound measuring guide. I have 2x2 gauze. My wound care kit also comes with 4x4 gauze, and I have my sterile cotton tipped swabs. Okay, I'm going to be pushing on my glasses a lot, just heads up. Okay, so the first thing that I'm going to do, oh, and I also have an extra ABD pad for the new dressing. Okay, so the first thing I'm going to do is I'm going to gently remove the ABD pad from the patient. Just gently move it from around the edges. And what I'm going to look for on the ABD pad is if there's like any blood, pus, any kind of exudate. If it is, I'll just fold this in half and then put it in the biohazard bag. If it doesn't, I can still, if it's clean and there's no blood, there's no pus, there's no bodily fluids, I would still fold it in half and I can put this in the regular trash bin. All right. So the next thing is what we're going to do is we're going to pull the dry gauze, and we're going to remember the count, how many pieces of dry gauze was used, and this was just one. So of course I would check for any blood, pus, or exudate. This is still clean, so I can throw this in the regular trash or the biohazard bin if there was blood or pus on it. So I'll just put this in the biohazard bag. Okay, and then our next is the wet gauze that we pull from the wound, and this would probably more than likely have blood or pus on it. So what we're going to do is, since our gloves have touched this part of the gauze that has blood on it, what we're going to do is remove our gloves, put them in the biohazard bin, and we're going to perform hand hygiene and put on new gloves. And what I'm going to do is, we're going to irrigate the wound. Now, we would position the patient in a way that to where if their wound was draining or leaking anything, that it would leak onto. And then just for the video's sake, I'll just open up my wound care kit. But we would have a drape under the patient just in case any wound drainage were to fall on the sheets or the bedding, that the bedding and sheets will be protected because we have this drape underneath them. But for video purposes, I don't have enough space to do all that. But yeah, we would use the drape to protect the sheets, the mattress, from any bodily fluids or liquids that are used in this procedure. Also in our wound care kit, we have the normal saline solution, and we have a few pieces that we actually don't need. And of course, it also comes with a biohazard bag and the 4x4s. Then these pieces we don't need. Okay, so for irrigation, we have our irrigation syringe, and we have the patient position, and the patient would be positioned to where once we irrigate any of the drainage would fall into the irrigation tray. But we would use our irrigation syringe filled with the sterile water or the saline solution, and we would actually irrigate the wound from least contaminated to most contaminated, stop irrigating or stop the flow of solution, and then we'll begin again from least contaminated to most contaminated. We'll make sure that the end of the syringe does not touch the wound. It is not supposed to touch, the tip is not supposed to touch the wound at all. And so once we have irrigated the wound, we will use our wound measuring guide to measure the length. This guide does not touch the wound or at all. We just hover over. So this is the length, and then we'll measure the width of the wound. And then to measure the depth, we would take one of these sterile cotton tipped swabs, and we will go to the deepest part of the wound, and then we'll measure that tip against the wound measuring guide. The other tip inside the other sterile tip inside the package can be used, like if this wound were tunnelling, it could be used to help put in the wet gauze, to position the wet gauze in that tunneling wound. And so with this tip, we would throw it away in the biohazard trash bag. And then, so the next thing is, we're not going to use the 4x4s that was in the wound kit. We're going to use the 2x2s because this is a small wound. And since this is a small wound, this is one piece of gauze. We are going to actually cut it a smaller piece because this wound is small. And then we're going to put it in our wound tray. We're going to, I'm going to take my other saline. We're going, since it's already open, we're going to wet that piece of 2x2 with our normal saline. For financial purposes, we don't have to open up a new bottle of saline solution. We have the one that was used before to save the patient money. All right, and what we're going to do, and this was one piece of wet gauze, just like before, and we're just going to pack the wound. Make sure not to go over the borders because we don't want to cause skin breakdown on the normal healthy skin tissue. We just want to stay within the boundaries of the wound. And then also we need one piece of tri gauze. And so we'll just use this 4x4 and we'll just fold it in half, and then we'll put that over our wet gauze and wound. And then the next step is what we're going to do. We're going to take our ABD pad with the blue line facing up. I'm going to place this over. And then we're going to get our tape. Our patient or my patient skin is not sensitive to plastic tape. So we can either use plastic tape or paper tape, but in this case, we're going to use plastic. And then I'm going to tape the short side first. Oops, I will not do that. Real life. Okay, let's measure this. So you're going to tape this side. Then you're going to take the longer side. And then the other side. Okay, so that's all taped up. And then we would just throw away in the regular trash any supplies that were soiled or any, we would keep supplies that we have not used, just in case for the next shift that there needs to be another change. So we can do this instead of, opening up or using another set of supplies. And then we'll straighten up our clean up our area. And then what I would do is of course put the call light next to the patient, lower their bed to the lowest setting, place up their top side rail, ask them or tell them that I'll be back in 30 minutes. But if they need me, they can punch the call light and I'll be there. What else? What I would document, I would of the wound per facility protocol. I would document, the color of the wound, the odor of the wound, the consistency of the drainage that is coming from the wound, and the amount of drainage that is coming from the wound, and that is per facility protocol. I will also document how the patient handled the procedure if they were in pain at any time during the dressing change. And of course, I would take off my gloves. I will perform hand hygiene. And then I've already given my patient the light. I've already lowered their bed to the lowest setting. Already raised their top side rail. This was normal saline that we used for both the irrigation and the wetting of the wet gauze. And again, with the wet gauze, we want to put the wet gauze. We want to cover only the area that is infected, the wound area that is infected. We don't want to cover any of the fresh, intact skin or healthy skin because we don't want to cause skin breakdown. We measure the length, width, and depth of the wound. We use sterile swabs to measure the depth, and we just measure that against our wound measuring guide. We use 2x2 gauze because the 4x4 was too big for this, and so I just cut a little bit more of my gauze so it could fit the wound better. And we used a drape would be under the patient, to allow if there was any wound drainage that it would drain onto the drape and not the bed, soiling the bed or anything. So the drape prevents that. We will position in doing the irrigation. We will position the patient in order for any of the irrigation fluid to fall into the irrigation tray. And we place the ABD pad blue side up. Make sure it's all secured around the edges. Make sure to fold like when we're removing the ABD pad, we fold it in half, especially if it had any blood or pus or exited on it, fold it in half and throw it away in the biohazard trash bag. And I believe that is it. All right.